طيب بسم الله الرحمن الرحيم والصلاة والسلام على سيد المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. Okay, so shifting gears now from basically learning how to learn to the next topic. This is something that's required by a lot of physicians. Research is now fast becoming something that's required by a lot of institutions, and a lot of you, as you go into your application for residency programs, you need to basically do or be a part of research. And a big part of research is to know how to conduct a medical literature search. The idea being is that if you're doing a research project, you don't want to start from the start. You want to see what other people did so that you don't replicate the work. You want to see where they went wrong. You want to see what they did, how they did it, how did they solve certain problems. So you need to get those articles. And the way you do that is by doing a medical literature search. And by far, at least from the experience of my residents in emergency medicine, when they come to do the proposal, the problem that they usually have when they're doing the proposal is doing the background medical literature search. They go and they tell me, well, we didn't find a lot of articles. We found like 5 articles. And then when I went and I did the medical search, I found like 82. So obviously there was a problem there. So this is basically a way of teaching you how to do methodical search through the medical literature. As always, I don't have any financial or intellectual conflicts of interest. Basically, I don't get any financial support from anyone, so the opinions that I'm giving are just my own. Okay, so what are we going to talk about in this lecture? We're going to introduce you to evidence-based medicine and the evidence-based information and practice that we are practicing in this day and age. We're going to look at the different steps you need to perform medical literature search, how you're supposed to ask the question that you're supposed to search, what are Boolean logic operators, and what's the language that PubMed uses, and how to actually do a Medline or PubMed search. Okay, hopefully this is going to be, I'm sure you know some of it, and if you don't know bits and pieces, this is your chance to fill them in and basically have a complete picture, hopefully. So first of all, information and evidence-based medicine. The idea is you guys are different from the generation that was before you. You're different from the consultants that are currently practicing, because you are in the modern age. You are going to be dealing with evidence-based medicine and evidence-based practice, okay? You guys are different from the previous generation, where they learned by simply copying their teachers. So if you had the fortune of getting a good teacher, you were a good doctor, and if you had a bad teacher, you're a bad doctor. Nowadays, this doesn't matter, okay? Basically, experimentation must be done with the human body for testing of a drug on a lion or a horse might not have the same effect on man. Right? Earliest quote about evidence-based medicine, Ibn Sina. So why do we use evidence-based practice? Well, there's a lot of reasons. We have too many patients. We have too many diseases, too many problems. We have too many questions. We have too many journals. We don't know where to read from. There's too many apps. There's too many sites. There's information overload. And what we need is to get the relevant information that we want for that patient at that time, in that circumstance, to do the right thing. We don't have a time to read, so this also ties in with the previous lecture. So we are really busy. We read what we like. Again, if I like cardiology, I'm going to read more cardiology than I'm going to read endocrinology. So we read what's familiar, and we avoid the difficult stuff. If something I know that I don't like and I always have a problem with, I'm going to stay away from. This is just human nature. Okay, so this is what the problem is, and this is why we have evidence-based practice. Now, in the realm of evidence-based practice, we have clinical expertise. Okay, this is what you learn in medical school. This is what we teach you. This is what you read. This is what you find on the net. And intertwined with that, there is the best research evidence. This is the best studies that are being done on a certain topic. And coupled to that, you have your patient. Now, the green circle, okay, is going to change from one patient to the other. Okay, so some patients might be educated, other patients might not be so educated. Some patients might be taking care of themselves. Other people are basically they don't care for their health. Some people take their medication. Some people are non-compliant. So the green circle changes from one patient to the other. Your clinical expertise grows as you go along, and you become you go from a senior, from a junior to a senior, and as you have more years under your belt, definitely the research and the evidence changes from one year to the next. That's why we don't depend on books. There's a lot of studies that showed that 50% of what's in the book is actually incorrect, okay, which is alarming. And of course, the patient changes. And the intersection of all of these is what is known as evidence-based practice. So evidence-based practice simply is the part in between all those circles. This is evidence-based practice. Okay, so when you want to practice this, this is where you're practicing. You're bringing all of those together. Now, there are 5 different A's for evidence-based practice. It's basically the stuff that you go through when you're practicing medicine, okay, in the modern day and age. So the very first thing that you are going to be faced with is you will be asked a question by your patient. So, doctor, do you think I should be using breast milk or formula milk for my child? Do you think I should be using drug A or drug B? So you have a certain expertise, okay? But because you're doing evidence-based practice, what you're supposed to do is take this question and go and look for the evidence. And this is what we're going to learn here today, how to look for the evidence, okay? Later on, obviously, the evidence that you find might be bad evidence or good evidence. There are studies that are absolutely crap. They're rubbish. And there are studies that are really, really good. So after you go and you find all of the studies, you have to go through them and then appraise the evidence. See how good that evidence is. Is it really compelling? Or is it, it's very weak and kind of we don't know what where the benefit is. So the third step is appraising the evidence. So you go from asking the question, taking the question and looking for the evidence, getting the studies, then reading the studies and appraising them, and then you apply this to your patient. So when a patient comes to you and he says, okay, doctor, what do you think I have? And you say, you have an MI. Okay, so what do we do about it? And you say, well, you can take a thrombolytic. A thrombolytic has 50% that it will dissolve your clot. However, you're at risk of maybe bleeding in about 5% of people. And it can kill you in about 3% of people. So here you're presenting your patient with the evidence, okay, that you have looked for, and you have amassed through your experience, and you let them do what's called shared decision making. So they can apply their own values. They don't always have to conform to your values. So, for example, it might be absolutely justifiable to you, for example, if somebody has been in a trauma or an accident and they've bled, it's common sense for you to give them a blood transfusion. Now, when you come and you tell someone, look, we're going to give you a blood transfusion, there is a very, very tiny risk that you might get an infection. It doesn't happen very often, but it's still something that does happen. Okay? Now, there are patients that will tell you, well, how much is tiny? And you will say, for example, well, there's a chance 1 in 3,000 patients might get HCV, hepatitis C virus. It's 1 chance in 3,000. Now, some patients will say to you, that's fine. It's really tiny. I don't think I'll get it. Give me the blood. And there are patients that will tell you, I don't care if it's 1 in a million, I am not taking the chance. So these are 2 different patients with 2 different values. So we don't really apply our values. We only apply our values when the patient says, doctor, do what you think is best. If this was your father or if this was your child, what would you do? And you will say, well, I would give them the blood, and say, okay, let's go ahead. Okay, so this is applying the evidence to your patient and taking your patient's values and traditions and background into consideration and their opinion. And then the final step of evidence-based practice is to see how does this affect your own practice. So this is a kind of reflection on what you've just did, on the question that you have been asked. You've looked at the research, you've appraised the research, you've applied it to one patient, and then you will see that over time, every single time you're going to be asked that question by your patients, you have some idea that, well, most of your patients will take the thrombolytic. Most of your patients will take the blood, rather than maybe there are some who don't want to take it. And you'll ask them why, and you'll find out. And so you will use that the next time you're asked the same question. So this is the basically the idea of evidence-based practice. Okay, the 5 A's: ask a question, acquire the evidence, appraise the evidence, apply to your patient, and then assess how this has changed your practice. Now, the ideal information. What is the ideal information? Is it basically the most current information, the most updated information? Is it the exact information we need? No more or no less? Is it the most reliable? Is it the most complete and comprehensive? Is it the most easily accessible? Well, I know, yes, I can open the book, but I don't have the book right now. All I have is this table. So is this the ideal information? Is it the most accurate or the most affordable? Well, it's kind of a combination of all of these. The ideal information depends on the situation and depends on what you're trying to do, and depends on what you have accessible to you. If you're practicing medicine in the middle of a village in Africa and you don't have access to the internet, then it doesn't matter what information is on the net. I don't have access to it. Okay, so the question is, where are you getting your information from, other than your teachers and basically the stuff that your friends tell you? So you can get information from textbooks, but as we said, these are usually 5 years out of date. If a book comes out today, it's already 5 years out of date. Plus, there's a lot of stuff in there that was true at the time when the book was printed, but it's no longer true, but it's still in there. There are so many things that we've learned in medical school that are now completely and utterly false. and they're still in the books. That's the problem. That's why when I used to teach at Ibn Sina, I used to tell my 50-year medical students, look, 50% of what we're teaching you is wrong. Not because we want to teach you wrong stuff, but because it's in your books. The problem is we don't know where it is all over the place. Okay? When they come up with a new edition, they don't go through the entire book and remove whatever is not um, uh, true anymore. They just put in the new stuff. Well, a new guideline came out, a new therapy came out. That's what they put in. They don't go and remove the old stuff. So textbooks are really a bad way to get really sensitive information that pertains to your patient. It's a good way of getting what is known as back information. Background information is the stuff that doesn't change. So things like anatomy. Anatomy is not going to change. The course of the median nerve is not going to change. The way that the brain is split is not going to change. The way that the bones articulate is not going to change. So there are stuff that doesn't change. The pathophysiology doesn't change. What changes are things like treatment, things like benefit, mortality, things like this. If, for example, nowadays we have a corona pandemic, okay? This wasn't there 2 years ago. So this changed, and therefore our practice now changed. Okay, the way that you approach patients, the way that you take precautions is completely different from the way you used to do stuff 2 years ago. Okay, so you can take your information from published guidelines, which are updated. The problem is guidelines have problems of their own. Unfortunately, they're not always correct, and they tend to apply the concept of one size fits all, which is not the way things work in medicine. Okay, most guidelines tend to basically give you a major idea of what you're supposed to do for the most part. However, they cannot take into account every different patient, and every patient is different, and every piece of information is different. So when you try to individualize, it's like trying to buy a suit that is basically made for everyone. Now, everybody's body is different. Yes, it's going to fit, but it's not going to really fit to everyone. You can use CATs, which are critically appraised topics. These are different sites on the net that are dedicated to basically searching the net for publication and studies in your field of expertise. So let's say you're a surgeon. There are things that are specialized in general surgery. If you're a hepatobiliary surgeon, for example, there are things that specialize in hepatobiliary surgery. You can look at peer-reviewed journals. You can look at specific sites such as Medscape. I'm sure everybody knows UpToDate. I'm sure everybody knows WebMD. So these are specialized medical websites that offer either information or recommendations or guidelines or such. And of course, there's the medical database search, which we're gonna go through today. So mainly PubMed. It's basically where you can get the different medical literature to base an opinion to give to your patient. So the idea is first to get a hold of the studies. Now, obviously, I'm going to give you here some examples of certain medical sites. Again, I don't receive any financial support from any of those, but I think they're really good. First of all, there's Best Bets. Best Bets is basically evidence about different topics, a question being asked and searched for the evidence for it, and it actually applies at the end an opinion, what they thought of the studies. WebMD is a very known site. Everybody knows this. It applies, it gives you good information. It gives you background and foreground information that you might need depending on the disease. Medscape is another big site as well. It offers the same information that's being given in WebMD, but it's also more comprehensive. The Cochrane collaboration, this is another site that actually specializes in meta-analysis, which is the highest form of evidence-based medicine. They're quite good, and they give you sort of rundown of all the studies that was done on a certain topic, and that's really, really good because it encompasses all the evidence that you need on that topic. Okay, and it gives you obviously the studies that they did that decision on. The Agency for Healthcare Research and Quality, this is a place where you can get guidelines. It's quite a site. It contains tons and tons of information, and it actually used to run the next site that is on the screen, and that's the National Guideline Clearinghouse. The National Guideline Clearinghouse, this is like one of the top US government agencies that offer medical guidelines, similar to the American Heart Association. Okay, you can go there for all the guidelines that are present nowadays and active. You can go to the American College of Physicians, for example. They do a lot of critical appraisal. So if there's a major study that came out, let's say about the COVID or about sepsis or whatever, they will tell you what they think of it, what the limitations are, and should you use it or not use it, and then it's up to you. So they're kind of doing the work for you when it comes to assessing the evidence for actual practice. Up to Date is definitely one of the most famous sites now. Obviously, it's under Wolters Kluwer. A lot of students use this. A lot of physicians and consultants use this, and more to my neck of the woods. So more towards emergency medicine. Life in the Fast Lane is one of the absolutely wonderful, wonderful sites that provides cases. It provides training, it provides ECGs, provides radiology, tons of stuff that will actually be useful for you to use, whether you're a student or an intern or a resident or what have you. And finally, one of the best I've seen for especially staff physicians who are not board certified or who are not experts, the 5-minute consult. What you do is basically you put in the different symptoms, or I want to know about, I don't know, infectious colitis in 5 minutes. This is the site that actually gives that. It gives you quick epidemiology, quick ways of diagnosing, the criteria for different scores, the mortality, what you should do, the first-line drug, second-line drug, and so on. So it's extremely useful. So as you can see, there's just too much information. There's an overload. I can search for any study by so many ways. I can do it by title. I can do it by date, by author. Usually you will hear your colleagues come and tell you, did you see the article that came out in the New England Medical Journal? Did you see the new meta-analysis study that came out by Cochrane? So there are so ways that you can search the literature. It's really too much. Of course, this is all good because it gives you options. So if you don't know the proper spelling of the name, I know the date. If I don't know the date, I know the journal and so on. So it is good, but it's still an overload. Now, I want to please ask you, stop using Google for medical searches. Okay, Google is a fantastic search engine. Okay, don't get me wrong, I absolutely love it. But I love it to look for a plumber, to look for somebody to come and do my driveway, to look for a restaurant, to find out where the location of my friend's house is. That's what I use Google for. I don't use Google to give me medical information, simply because even though it's a fantastic engine, I cannot trust the information on that site. So asking Google a medical question is basically like coming to the hospital, and instead of going in to see the physician, you're asking the security guard outside about your medical condition. That's the exact example when you ask Google to tell you whether or not somebody should get a certain treatment. So please try and use medical databases. Now, this is a huge list of the international medical databases that are available to you. Okay, you can access any of them. Okay, some of them are free, some of them are paid, obviously, and you can see some of them are really good, like Clinical Key. They're general. Some of them are very specific. Yes, you can see that even in the middle there, King Abdullah bin Abdulaziz Arabic Health Encyclopedia. This is one of the national projects that has been being developed in our country. It's an international database that is very well respected internationally. Obviously, you have Medline and PubMed. You have EMBase, and you have things that are very specific. So you have things like gene review, so people who are doing genetic research. You have things that are, for example, disease ontology. Or, for example, you have things that are related to infectious diseases, like influenza research database. That's a database just purely for influenza viruses. Another one is for HIV. So you can see there are sub-specialized databases, and there are general databases, such as Medline and Europe PubMed and Clinical Key. So these things give you general medicine. The two major public databases that are available to you are simply Medline, which is PubMed, basically. PubMed is the actual name is Medline, okay, medical line. And there's EMBase. EMBase is short for Experta Medica Base database. Okay, the difference between them is somewhat considerable. Okay, Medline is US based, EM-based is more in Europe. Medline obviously goes way back before 1966. It contains a lot of data. EM-based goes all the way back up to only 1984. Medline contains more than 20 million, while EM-based 1.8 million, almost 1/10. It covers huge publications, okay, and it's free. And that's a major selling point when you want to search. While EM-based, you actually might register and need to pay to use, or if your institution has already paid and gives you access, depending on which hospital you're in, you can use the institution subscription account to access the EM-based. But obviously, there are things that are covered by both, and there are things that are covered by one and not the other. So when you come to do a research, you have to, or a medical literature search, you have to actually know what database you're going to look for or look through, okay? Because some studies might not be included in one, but included in the other, okay? So a comprehensive one would do a search through the major 3 or 4 databases online. So the first thing is you need to structure your question. So what are you looking for? That's the first part of evidence-based medicine. Ask a question. So what do I want to know? General questions are not recommended. I can't search for a general question. Okay, I'm going to show you an example now. Okay, if your question is already being answered by a guideline or a peer-reviewed database, don't do the work again. Just go and take the information from there. If you're doing research and you need to get the information, or you need to get the studies from which the guideline actually took its recommendation, that's fine. You can do that. It's just that, you know, if you can help it, you don't need to do the work twice. You have to identify the searchable terms. when you make your question should be structured in such a way that it has actual searchable terms. Okay, it must contain at least one searchable term, and it must contain something called a mesh term. And we're going to go into what a mesh is in a few slides. So just bear with me. So you have to formulate your question in a proper way, okay? And after you do that, and after you identify the different searchable terms, now you can go and use something called the Boolean operators to either expand or explode your search, or narrow or focus your search. So the Boolean operators allow you to build up or tear your search down. It allows you to combine information, okay, from different databases, and to expand your search or narrow it depending on what you want to do. And we're going to see this step by step in the following slides, so don't worry about it. Okay, now once you have got your list of articles on your topic, you might have too many. So for example, if you did a search and your search showed that you had 800 articles, that might be a little bit too much. So you might need to refine your research more. So you apply different filters. So I don't want all the studies done on this topic. I want the studies done in the last 5 years only. Or I want the studies done that are randomized controlled trials. I don't want to see case reports and retrospective chart reviews. Then I can, if I find an article that is really on the topic that I'm studying, I could just do something called chain citing, which basically I take the article and I go to its references and I see their literature review. And then I collect the stuff that is compatible to me or what I want from their reference section, from their literature review in that study, and I get those studies, and then I go to their reference section and look at the studies that they referenced, and so on and so on. This is called chain citing. So I go from one article and I look at its references, and if I like something in the references, I take that article from the references, bring it, and then look at its references, and so on. So all of this is to simply get me the best and most comprehensive evidence regarding my topic. Okay, now after I got my results, I have to basically assess how many I got. Are they the right sort of studies that I want to look at? Are they what I need? And if I don't have what I want, then I have to change my search, either making it bigger or smaller, or maybe change the words that I search by, or change the dates. So basically, this is the idea. So the first thing you should do is learn how to ask the question. This is the most important thing. If you formulate the question in a proper way, it's going to help you to search in a methodical way in such a manner that you will not lose any relevant information. You will not get an evidence literature review and your colleagues will tell you, well, I didn't find this study, but you did. Okay, so an example of a novice question, or a question that is asked by somebody who's not an expert, is, for example, what do you know about ACE inhibitors and heart disease? This is a bad question. Okay, so can you look it up for me? If you put this, okay, ACE inhibitors and heart disease into PubMed, you're going to get 19,294 articles. Okay, now you're not going to spend your time going through those many articles that came up. Simply, you don't have the time. I'm sure there's a lot of stuff in there that has nothing to do with ACE inhibitors and heart disease. Now, what you're supposed to do is ask the same question, but in an expert way. So basically, what's the most current evidence regarding benefit of using ACE inhibitors in the elderly who have heart failure? Okay, So be specific. What heart disease are we talking about? What are we talking about when we talk about ACE inhibitors? Are we talking about benefit? Are we talking about side effects? Are we talking about complications? What is it exactly? So when you do this in a proper way, look how many studies this turned up. Okay, this turned up 30 articles from 20,000 just simply by doing the proper search. I went down to 30 articles. Okay, this is how important formulating the question in the proper manner is. Now, the way that you should formulate your questions is by using something called the PCOT method. Okay, this is the same method used when you assess literature. So you need to define what population you're talking about. Am I talking about people with heart disease? Am I talking about diabetics? Am I talking about people who are unstable, people who present to the ER, people who are coming out of the ICU? What population am I talking about? Then, what am I testing? What's the intervention? Is it a drug? Is it a test to diagnose a disease? An imaging? A lab test? What exactly am I looking for? And what am I comparing it to? So, did those who took ACE inhibitors do better than somebody who took nothing? Or did the ACE inhibitor do better than somebody who took a diuretic, for example? So what am I comparing it to? And what's the time in the last 10 years, in the last 5 years? And what is the type of study design? Is it a survey that I'm looking for? Is it a randomized controlled trial, a meta-analysis? So all of this has to be in my question. So the problem with free text searching is that basically you're searching, let's say, for this question. Okay, so the question is, does smoking shisha cause lung cancer? This is my question. This is what I want to search for. Now, if I just type this in, I am going to get some results. The problem is I'm not going to get the complete results. And I might miss some crucial piece of evidence that if my colleague did a methodical search instead of just doing a general search, they will get, I will not get. Okay, so I will be missing articles, and I might be getting a ton of other articles that have nothing to do with this. Okay, so the problem is basically here in this question, what are the searchable terms, the things that I'm going to search for? Shisha and lung cancer. So that's what I'm going to search for. Okay, now the problem is how many ways do you know shisha can be spelled, and how many names does shisha have? Obviously, you can spell shisha with all of these names, and you can basically call it different things. It's been called different names in different countries. So it's been called shisha. If you go to Masr, it's goza. If you go to إذا أنت في مكة جراك. If you go to the UK, it's water pipe or habli babli. If you go to Beirut, it's argila or nargila, also known as hookah or hookah, and different spelling for each. So are you going to run a search for each single one? That's just a waste of time. So that's why if I put shisha with a certain spelling, that means that the search engine is gonna disregard any other spelling. So there might be a study where shisha, instead of being spelled with an S, it's spelled with a C. Or instead of writing shisha, they wrote hookah or habli babli. That article is not going to show up if I write shisha and lung cancer. So this is one of the problems. Okay, the other problem concerns lung cancer, the medical term. Okay, now lung cancer goes with so many names. Okay, now if I put a table for you right here, okay, the word cancer can be cancer, it can be neoplasm, it can be mass, growth, tumor, carcinoma, neoplastic disease, and this can apply to lung, mediastinum. So saying lung cancer is just the same as saying pulmonary neoplasm. It's just the same as saying small cell carcinoma. All of these are different wording for cancer. And if I'm going to do a search, as you can see here, each row contains 9 different terms, okay? And I have 7 rows. So I have, if I really want to search for all the terms that lung cancer can be written with and the different combinations, I'm going to be doing 2,500 searches, which is not going to be done, obviously. So how do we solve this problem? Well, this is what you're here to learn, okay? Now, what are the Boolean operators? So the Boolean operators, these are different logic operators that are built into the search engine all over the world. You use them in Google, you use them in PubMed, in EMBase, everywhere. And the Boolean operators are the and, or, and not operators. This is the way that you combine terms. So if I want to find out about shisha and lung cancer, okay, this is the way of doing it. So when I write insulin and acidosis, the search engine automatically puts the word and in the middle. So it searches for that term and that term in the same study. So the or operator, so if I'm going to look for basically people who play football or hockey or basketball, so that means or is an additive operator. It adds all of these different people. So there are people who play basketball and football. There are people who play hockey and football. Okay, and when I put or, I'm using all of them. So or is an operator that explodes your search. Explodes just means it makes your search bigger. Okay, it increases the sensitivity of your search. Okay, it takes into account those that play basketball as well as football as well as hockey. Now, if I use the not operator, the not operator excludes stuff. So it focuses your search instead of exploding it. It does the opposite to what the or operator does. So for example, if I want to see venous ulcers, not gastric ulcers. So venous ulcers are those ulcers that are in the ulcer circle, but they're not in the gastric circle. Okay, so the not operator basically excludes stuff that you don't want to look for. Okay, so if I'm looking at smoking and lung cancer, but I don't want to look at cigarettes, so I'm going to put smoking, then not cigarettes, and lung cancer. So this gives me all the lung cancer studies that are involved with pipes, with cigars, with hubbly bubbly and water pipe, with electronic vaping, okay, anything other than cigarettes. So this is an operator of exclusion to focus my search on the stuff that I want and to get rid of stuff that I don't want. The AND operator, this is by default the default operator. As we've said, it takes into account the intersection of things. Okay, so if I'm looking at, for example, salmonella and hamburgers, okay, so when I look at salmonella and hamburgers, okay, this gives me the articles that deal with salmonella infection with hamburgers and not with salmonella infections in eggs, for example. Okay, so this is the different selection where I have to have both items of my search in the same study for the search engine to pick up that study. Okay, so basically it focuses your search. Instead of taking everything in both groups, it just takes what's common to two groups. Okay, so the AND operator focuses your search, the NOT operator focuses your search, the OR operator explodes your search. So that's basically how it's done. Now, you can have combinations, obviously. Okay, so for example, if I have salmonella, eggs, and hamburgers, and I ask the question, basically, I want salmonella and hamburgers or eggs. So it goes from the left to the right. Okay, so salmonella and hamburgers is this part of the Venn diagram. And then when I add eggs to it, I'm going to include all the ones in the eggs Venn diagram to show up. So I'm going to end up with these articles that cover salmonella and hamburgers and then or eggs. Okay, so this is how you can combine Boolean combinations. Okay, so it's going to take the first one first, then the second, then the third, or it's going to take the ones inside the brackets first. This is what's called nesting. Nesting is basically putting something inside something. So it's exactly like doing math. Okay, so if I put the same question, salmonella and hamburgers or eggs, and I put brackets around hamburgers or eggs, the search engine is going to do that one first. So hamburgers or eggs is basically going to combine both of them, and salmonella. So you're going to get basically the intersection between salmonella and both hamburgers and eggs. So it's a different result as before. Okay, before we had eggs and the intersection between salmonella and hamburgers. Once we put in the brackets, the operator does the brackets first. The search engine does the brackets first. Okay, now there are some searching language that you should understand. This is pretty much standard internationally. You can use them on any databases. Okay, so basically you can do a general free search. You take your topic and you just stick it in. And there's something called automated term matching. So if anything matches the term or is of slightly different spelling, it will take it into account. Now, the problem is when you do this, you're going to miss some studies that are important, and you're going to get a ton of information that is not important. So it explodes your search if you just do a general free text searching. Now, if you want that particular word, you're looking for that particular word, immunocompromised, you can do an exact phrase search. An exact phrase search, you put speech marks around the word that you want. That means that the search engine is just going to look at the article that has that exact word in it. If it doesn't, it's not going to count the study as something that it should fetch. Okay, so you have general text and you have exact free text searching. One of the most important and fantastic ways of searching is the truncated search. The word truncated means it's like the trunk of a tree and then it has different leaves. Okay, so زي ما نقولوا بالعربي الجذر. Okay, but instead of searching for the entire word, I search for the part that I know is there. So for example, if I put immune and I put star, star means truncated. It's going to give me all the different combinations that starts with the word immune. Okay, so immunocompromised, immunocompetent, immunodeficient, immune complex, response, immunity. So just by putting the word, okay, or starting with the trunk, okay, it's going to take everything that starts with that trunk. Okay, so this is how you do truncated search. In some databases, you can do a limited truncated search. Okay, so you can actually put the truncated star and then you put a number after it, and this tells the search engine that I need all the different combinations that starts with the same trunk but only has 3 letters after it. Okay, this is not applicable in PubMed. It's sometimes used in Ovid and it's sometimes used in EMBase, so it's not very popular. Sometimes you might even search words that have different spelling between American and British. So pediatrics spelled the American way, P-E-D-I-A, rather than the British way, P-A-E-D-I-A, as you can see. Instead of EA, the place where there's a spelling difference, I will put a question mark, and that is going to take both considerations of the spelling into account. Now, this only works in the European databases if you're going to use those. But for PubMed, this doesn't exist. It's just the truncated ways of searching. Now, when you talk about the sensitivity and specificity of a search, the more sensitive a search is, the more references it is, the bigger it is, you have less chance of missing good evidence. But on the other hand, there's a lot of stuff that's going to be included in your search that is completely useless information. So you actually have to go and filter it. The more specific a search is, the more precise it is, the less number of studies there are. You might have a chance of missing something which is important to you, but you'll have a lot less junk than with a sensitive search. So basically, increasing the sensitivity of your search basically broadens your question. Instead of asking a very precise question, you make it a little bit more broad. So that's usually when you have, for example, you do a search and you get like 2 articles. So probably maybe you're asking a very specific question. So maybe you should make your question a little bit more general. On the other hand, if you have, for example, if your search comes back with 30,000 articles, that's way too much. So you need to refine or focus your search or increase your specificity, and this is the way you do it, by using a focusing Boolean operator, or narrowing your parameters, or narrowing your time limits, or narrowing the type of study that you're looking for, or making your question more specific. So instead of talking about heart disease, you're talking about specifically mitral valve regurg, for example. So this is what you can do with different searches based on did you get a large number of articles or a small one. Now, you've heard me mention the word mesh. What the hell is mesh? Mesh is simply, it's just a database within PubMed, okay? And mesh is basically, it stands for medical subject heading. This is something that is unique to PubMed. It's only on Medline, okay? You will not see this in the EMBase. You will not see this in the international health databases. This is something unique to PubMed, and it's good because it makes things a lot easier for you. You remember this table? This is the table that we talked about when we came to talk about the cancer and the different ways and combinations that I can say lung cancer. I can say lung cancer, I can say mediastinal tumor. It means the same thing. But if the author of a certain study wrote the title with the word lung cancer, and an author of another study wrote the title mediastinal tumor, one is going to be picked up by the search engine and the other is not. So to avoid that, we use mesh. We use the medical subject heading. So what is basically mesh? Mesh is a database in PubMed, and basically when you put in any combination of a medical term, let's say I put in the word lung tumor into mesh and I do a search, the number of articles I get is the exact same if I put in pulmonary neoplasm, because it takes into account all the different combinations that I can say the word lung cancer. Okay, so basically what mesh does is you can put in any combination of the word and it will give you all the different types or the different meanings for it, or the different clinical terms for it that are in the database. So you don't have to actually go ahead and do the 2,500 searches for each different term on its own. It will actually give you the whole thing. So this is the point where we're actually going to conduct a search right now. So we're going to put in a question and search for it in a methodical way. And obviously you can apply this to any question you want. So first of all, we're going to do this on PubMed because this is the most common and this is the biggest website, and it's actually a free website, which is a big deal. This has been changed. The look of PubMed has been changed in the last few years. This is the way it looks right now. There is the search field, obviously. That's where you put in your search. This is the database that you're searching. So always above your search field is going to be the database that you're searching. So here you're going to be searching through PubMed. PubMed is a database. Mesh is a different database. There are databases, as I said, for genome, for genetic research, and so on. Over here at the bottom, you can see that you can change the databases. Okay, so you can go for the mesh database. You can go for the legacy PubMed. Okay. Over here, if you don't know how to use PubMed, this is where your tutorials are. Okay, you can basically check on how to search. If I want to expand my search, what should I do? If I want to focus my search, what should I do? The citation match retrieval. This is basically when you hear a friend of yours tell you, "Oh, you've heard about this peacock that did a study on heart failure." So there's somebody called James Peacock or whatever, that's his name. That's the guy who did the study. But I don't know the name of the study, and I don't know the journal. So I can go and search by a single parameter. I can search by topic, I can search by journal, by author, by date, and so on. Also, I can have an advanced search. So I don't just want to search for text. I want to search for the article that was done by Peacock on heart failure in the year 2000. So I can put in all these parameters and it will give me the different study. So for example, let's ask a question so that we can search it. So the question that we're going to ask is as follows. Basically, does aspirin or vitamin C have any benefit in the treatment of acute or chronic kidney insufficiency? So now, by doing that, these are the searchable terms, and these are the mesh terms. The searchable terms, the text searchable terms, are aspirin and vitamin C, and the mesh terms are acute and chronic kidney insufficiency. Okay, so the mesh term is the medical subject heading. Aspirin is not a medical subject. Okay, the medical subject heading is usually a disease or condition. Okay, so this is the difference between the text and the mesh. So first thing is you go into PubMed and you start with the mesh. So how do I go to PubMed and start with the mesh? So you go to the website, obviously, and you basically go and press on the word mesh database. It's right here at the bottom. Okay, and when you press on it, you go to the mesh database. Okay, so when you go to the mesh database, the screen is going to look like this. Okay, so now you're kind of in Medline, but you're not in PubMed anymore. You're going to be in the mesh database. It should say mesh on the top left part of your screen, and right next to the searching field, you will have a pull-down menu that contains all the different databases. And you can see there are databases for books, there are databases for genome, there are databases for journals, for clinical varieties, all kinds of stuff. And you can search through all of them, and you can search through different specialized ones. But for now, we're going to be looking through the mesh. Okay, so what are our mesh terms? So in this search bar, I'm going to put our first mesh term, which is basically acute kidney insufficiency. And when I do that, this database is going to return this screen. So acute kidney injury, okay? And here you have all the subheadings. So the database is asking you, what do you want to look for? Are you looking at the diagnosis of acute kidney injury? Are you looking at drug effects? Are you looking at etiology or immunology? Are you looking at mortality? Are you looking at therapy, surgery? What exactly are you looking for? So if you don't check any of them, it's going to look for studies in all of these subjects. And if you do check certain things, it's just going to limit it to either the therapy or the diagnosis or whatever you check it for. Now, right here on the right side of the screen, you have something called the Search Builder box. This is where you're going to build your search for literature, okay? So what you do is, now if you scroll down the screen, okay, this is what you're going to find. At the bottom of the screen, it's going to tell you the different entry terms that are included in your mesh search. So when I put the words acute kidney insufficiency, my mesh term, this database gave me all of these combinations. Acute kidney injury, kidney injuries, acute renal injury, renal injuries, acute, renal insufficiency, acute, acute kidney insufficiency, kidney failure, acute. All of these different combinations are included just simply by putting any one of them. So that's the idea of the mesh, and that's why this made it so much easier for us to search. Instead of putting in all the different combinations, you just choose one, and the database gets all the combinations for you and puts them all in one go. So for example, here, I've chosen complications, drug effects, drug therapy, etiology, mortality, and therapy. Okay, these are the parameters in my question. Does aspirin or vitamin C have any benefit in acute or chronic renal failure? So once I do that, so I chose which parts I'm interested in, I now need to put this in the search builder. Okay, and as you can see, by pressing on the button add to search builder, all that information automatically goes into the search builder box. So just by choosing what I want and then pressing the button under the box that says add to search builder, okay, the entire parameters for search goes into the box. Okay, now that's my first term. Now let me do the second term. So the second term is, after I add it, after I add the acute kidney insufficiency to my box, I'm going to go up to the search field, erase acute kidney insufficiency, and put chronic kidney insufficiency and run search. So now what you have is exactly the same, but instead of acute kidney insufficiency, you have renal chronic renal insufficiency. Now notice that on the right side, whatever I put in my box is still there, even though I ran a different search. So whatever I already put in the box, okay, is still there. And now I search for my second mesh term. And again, I'm going to basically choose what I need, the different areas that I'm looking at for chronic renal insufficiency. And now it's very important that when you come to combine the search, what does the question say? It says acute or chronic kidney injury. So now, before I press on add to the search builder button, I have to go and choose the Boolean operator that I'm using. So I need acute kidney injury, which is already in the box, or chronic kidney injury. Okay, so when I choose the Boolean operator, I put it to or, and then I press on the add to search builder. It's going to add it, and what's going to be done is going to be adding it with the Boolean operator or. If you can see here, right here in the middle of the box, it says acute kidney injury, mesh, and so on, and then says or renal insufficiency chronic. So whatever I had is now combined with the chronic in the way that I wanted it as per my question, because I was asking acute or chronic kidney injury. So now that I've combined my mesh terms, okay, so I went into the mesh database, I got all the different combinations for the acute, I got all the different combinations for the chronic, I added them in the correct way in the PubMed search builder. Now, this is what I'm going to search in PubMed. So the mesh database just contains the different combinations for the different diseases. Okay, that's all it does. It doesn't actually contain any studies. It just puts the terms for you. And now when you are ready and you put this in the search builder and you press, okay, that's what I need to search. I need to get all the articles that contain chronic kidney insufficiency or acute kidney insufficiency with all its combinations: renal failure, kidney insufficiency, acute, chronic, disease, whatever. When I press on search in PubMed, the search engine actually goes and gets all the articles that fulfill this, and you can see I have 128,000 articles that have acute kidney injury or acute renal injury or chronic renal insufficiency or whatever the different combinations are. So now I am sure that I'm not missing anything from the different combinations. Now that I have searched my mesh terms, you go up to the bar, erase everything, and then put in your text. So text, remember, we had aspirin and vitamin C. So if I just put aspirin and click search, it gives me all the articles that contain aspirin. So 67,000 articles about aspirin. Okay, so now I've searched my aspirin. Okay, so my next text is vitamin C. So erase the aspirin and search for vitamin C. Don't worry about the searches. They're being saved. Okay, so just the fact that you search for one thing and then you search for another thing, it doesn't mean that the first thing is gone. Okay, so searching for vitamin C turns back 65,000 articles on vitamin C. So after I do all of this, so I've searched my mesh terms in the proper way, I've searched my text terms, okay, and I got everything. Now I go into the advanced search, and the way that I access the advanced search is by pressing this button underneath the search field in PubMed. And when I go to the advanced search is basically, it gives you a history of all the searches that you've done so far since you started your session. Okay, so all of the stuff, you remember when I was searching for one and erasing it and putting the other, they're all here and you can see them at the bottom of the screen. So search number one was my mesh stuff, my acute kidney and or chronic kidney. Okay, search number two was for aspirin, and search number three was for vitamin C. And you can see the results for each one. So search number one, 128,000 articles. Search number two, 67,000. Search number three, 65,000. And now what I want to do is combine them the way that it is that I have asked my question. Okay, so if you don't remember the question, this is the question. Okay, the question says, does aspirin or vitamin C have any benefit in the treatment of acute or chronic kidney insufficiency? So this is our question. So here, depending on this question, I'm going to combine my different searches depending on the question. If the question was vitamin C and aspirin, that's different from vitamin C or aspirin. Okay, so here I have to combine search number two or search number three, which is vitamin or aspirin, and acute kidney and chronic kidney. So this is the way I combine the different searches. And when you do that, you will see in the middle query box that all the information that you've looked for is there. And now the search is going to only consider studies that are on those parameters that contain aspirin or vitamin C, and it contains the mesh terms. And lo and behold, from 128,000 articles, you have landed with 700. And this is how you do a search. Now, if 700 is too much, I can now go and refine it. Okay, and we're going to talk about this in the next coming few slides. But you can see now that if you ran a direct text search, you're either going to have too many or too few results. So if I just put aspirin in acute or chronic kidney insufficiency, and if I put vitamin C in acute or chronic kidney insufficiency, in one I'm going to get 132,000 articles, and in the other 123,000 articles. And if I combine them, I'm sure there's a lot that are in common. Okay, so if I do it in a general way, it's not going to be as easy as if I do it in this methodical way. Look for your mesh terms first, then add in your text as it's structured in your question, and you will get good results. Now, when you change your display, you can go to display options right here in the upper right part of the screen. You can have 20 articles in every page. You can have 200 articles in every page, and it will change your display based on what you want. If, for example, I did a vitamin C search, remember, and because of that, I got 65,000 articles. Now that's way too much. Now, if I want to narrow it down, I'm going to say, well, okay, I want only the ones that were done in the last 20 years. So right here in on the left-hand side, you have the time marker. Okay, so all I have to do is just simply slide the slider of the time marker to the dates that I want my search to be in. So if I'm happy to have a search from the year 2000 to 2020 instead of having a search from the year 1921, okay, all the way to 2020, I don't want 100 years of studies. I just want the last 20 years. Now you can see by doing that, I'm limiting my search. That 65,000 articles suddenly became 35,000 articles. So you see how I can limit my search based on what I want. Obviously, there are other filters you can use other than the date. You can use these by simply activating them. They're on your left side of the screen always. Okay, you can find them right underneath the date bar. So you can change the different type of articles that you're looking for. You can add additional filters. So I can change, for example, from 1921 all the way to 2000. So I'm taking the last 20 years worth of studies, and I want to apply different filters. So I want to only look at, let's say, randomized controlled trials. So I'll put additional filters by pressing on this button, and then I'm going to get the different filters by article type. Or I only want the ones that are in the English language. So I can go to the language and limit to those. Or I just want the adult ones or the pediatric ones. So I can do that through the age filter, as you can see. And this is going to limit my search. Let's say that I actually found an article that kind of deals with the thing that I want. So as I scroll down, you're going to go and you're going to find similar articles at the bottom. Okay, so what this is basically, this is the artificial intelligence of the search engine helping you. So it's like when you go to Netflix or you go to Amazon. People who have bought item X usually look at item Y. People who have actually chosen this article to read, they have looked at other articles to read with the same type of topic. So it kind of gives you a fine search done by the artificial intelligence. So you can go and look for more similar articles. It basically refines the search. You might at the beginning have a different word, and basically by looking at the similar articles, you find a different term for it, okay, that you didn't think about, and you might get a better result. Now, at any point you want to go back and see your history of the search, you can just press on the advanced search button, and all your search history here is present. So you can see I've searched for aspirin, I've searched for vitamin C on its own, I've searched for aspirin or vitamin C as a general search. I've looked at the similar articles for that one article. So everything that you do is actually recorded for you in case you need it later on, or you wanted to go back to that search and you forgot what it was. It's there and it's recorded for you, and you can go back to it. Now, there are some reasons, even after you do all of that, that you don't get what you want. And when you don't get what you want, you really have to ask yourself, am I using the right database? So for example, if I'm looking at heart disease and I'm using the genome database, I'm not going to get any articles, or I'm going to get articles with the wrong type of topic. Okay, is it the right time period? Maybe in the last 20 years there hasn't been studies done on Beryllium, for example. Okay, this is a drug that has been discontinued. Okay, so if I put in the last 20 years, and the last study that was done on Beryllium was in 1989, I'm not going to get anywhere. Okay, so are there better words I can be using, better terms? Do I need to explode my search? Do I need to focus it? Am I using the right mesh term? All of these things are important to get a good literature search. Okay, so finally, just to keep in mind what are the things you need to do, please remember that evidence-based practice is based on 5 different principles. You ask the question, you look for the evidence, and this is the way you look for the evidence. Okay, then you appraise the evidence, and appraising the evidence is a whole different course. This is basically how to appraise medical literature. There are courses about this, so you need to, it's out of the scope of this lecture. This lecture has to do with the second part, looking for the best evidence, and this is the way you look for the best evidence. Once you appraise it, or you take that evidence appraised from a professional site, such as the American College of Emergency Physicians, or the American College of Physicians, or Life in the Fast Lane, or whatever, you can apply this, and you take it to your patient, and you apply their values and what they consider to be important, and then you reflect on how does this change your practice. Please do not use non-specialized engine to look for specialized stuff. Don't use Google, please, because you cannot trust the information on Google. Google is a fantastic search engine, but not for medical databases. There are specialized databases for what you need. Always put your question in the PCOT format, please. Try to identify which part in your questions are MESH, medical subject headings, which part are texts and searchable, okay? Always look for the MESH first so that you can find out exactly what you're looking for. What aspects of that disease are you looking at? Complications? Are you looking at etiology, at imaging, at radiology, at treatment, at epidemiology? What exactly you're looking for, and use the Boolean operators properly so that you can get the list of studies that you need, okay? And basically, once you have your list and the list is too big, then you need to focus it, and you can do that by setting limits on the date or the type of study, or even refining the question to a more refined thing. If you don't turn up enough studies, then you need to generalize or broaden your question or explode your search, okay? And this is basically done by playing with the wording combinations and playing with the factors and filters that change your search. You can consider also going outside of Medline. The reason why I used Medline was basically because it's the biggest and it's for free, and that's what people use the most. Most importantly, please remember, when you really tried and you couldn't get anywhere, ask for help, okay? And the best people to ask for help, believe it or not, is the librarian in your institution. There's a person who runs the library in King Abdulaziz University Hospital, in Al Qura Hospital, in Taif University. There is always someone who runs the library, and that person is an expert in literature searching. They know all the databases, they know all the different shortcuts to them. They actually have access to databases that you cannot have access to. I cannot tell you how many times, I mean, the librarian where I used to work in National Guard was one of my best friends, because I keep sending her, she's a great old lady, and I keep sending her emails. Please, can you search for this question for me? I've tried doing that, and I don't have access to EMBase, for example, or I don't have access to the Library of Congress, for example, but they do. And even if you have an article that you need to pay for to get, they can get it for you for free, because they are basically members in an association that deals with medical information and database searching and all of that. So they are the experts. So if you need help, please ask for it. They can make your life easier. Obviously, that doesn't mean that you should go running to them with everything. You should do it yourself. You should learn how to do it yourself. And the more you do it, the better you're going to become at it. But when you're trying to conduct research and you really are not getting anywhere, or you're not able to get the list of studies that you want, this is the way of going about it, is to ask for help from the most expert people, and those are the librarians. With this, we come to the end of this session. Thank you so much for allowing me the time to talk to you. I'm sure I gave you a lot of information in such a short time. I hope it was useful. The handouts contain all the slides, so you can go back and go through them at your own pace and check each piece of information that I gave you for yourself and see, does it work for you or it doesn't work for you. It all depends. So basically, we are pretty much concluded, and I'm going to go for the questions right now to continue answering the questions, and I'm going to stay until we've answered all the questions regardless of the time. فيعطيكم العافية وشكرا. Okay. طيب. Continuing with the questions. في دكتورة بتقول طيب مثال قراءة سورة الفاتحة ما يعتبر ضمن التكرار يعلم الشطار، فلما يتكرر الشيء علينا كذا مرة راح يصير سهل للذاكرة و يعني ممكن استحضاره في الذاكرة قصيرة المدى. This is true. The problem is